Hello everybody, I am Alexandre Chaligne Zachariah, and I would like to take this time to present to you a tool that you might find useful in your work with people facing death, their family and also caregivers, but also an extension of this program for people who are not imminently dying. So this tool is called originally the Going Home program. It's a process that comes out of a larger body of work called Hemi-Sync, short for hemispheric synchronization. The Monroe Institute is in the United States, is currently where most of the research in Hemi-Sync has been done. The concept of synchronizing brainwave with sound tones has been the interest of the founder of the Monroe Institute, Robert Monroe. In the 1950s, he worked for a corporation that investigated methods of accelerated learning through the use of sound patterns. Through that research, it was also found that certain patterns of sound could induce other states, such as sleep, as well as state of consciousness not ordinarily available to the human mind. So on your first chart that you can see on the screen, it is the normal sleep consciousness continuum. This chart shows a normal pattern of brainwave activity of an adult for a long or short period of entering into sleep and coming out of sleep. Frequency and brainwaves activity has been divided into four broad categories: beta, alpha, theta, and delta. Each of these levels have been associated with different state of consciousness. A normal waking, everyday, stressed out state is known as beta. It is where we are most active physically, emotionally, and logically. Children have to learn to be in this state on a continuing basis on their own. They tend to avoid this level of activity for extended period of time of functioning. When you are in the detached level of awareness, your brainwaves are in the alpha level. This range from a calm level of being awake to dozing off. This is the mode where physical self-healing can begin to happen. Theta, for most people, is the level of deep sleep. As you can see on the right side, you have stage 1 sleep, stage 2 sleep, stage 3 sleeps, and theta is stage 2 sleep. For those who are able to maintain their consciousness, awareness in this state, it is a level of deep insight when you are fully awake and aware and that you are not sleeping. Drugs and alcohol, anesthesia, or narcotics can also artificially induce this level of brainwave activity. Delta, as you can see, it's stage sleep 4 sleep. Delta used to be referred as the level of coma or unconsciousness, but research has found that it is a level of deep sleep. You won't become rejuvenated and you will feel exhausted the next morning if you do not spend some time every night in stage 4 in Delta. So it's a state that everyone needs to access on a regular basis. It is where deep healing can occur. Most of us operate optimally in 1 or 2 levels at any given time. But renowned healers who have been tested with brainwave shows unique brainwave pattern that incorporates all 4 levels in a balanced pattern at once. It is scientifically verifiable that sound can induce brainwave and thereby influence consciousness. When a particular sound is heard that relates to a certain state of consciousness, the brain tends to produce the same state of consciousness, known as frequency following response, a condition known as frequency following response. This response can be learned and then recreated from memory without the necessity of audio input for initiation or reinforcement. On the second chart that you now see on your screen, this chart shows what can happen to a person's brainwave pattern when they utilize the influence of sound tone in a guided meditation recording. One of the basic premises for which of the Monroe Institute operates is that a person is more than a physical body, and that we can do regularly access those level of awareness. We can be and use those level of awareness that are part of our more expanded self. Sometimes we do this consciously, but more often we do it through our daydreams or through our nighttime dreams or through meditation or drugs. The Monroe Institute believes that it is possible and to our ultimate advantage to bring those state of awareness under conscious control, conscious physical control, where we can access them at will. Robert Monroe's journey in investigating the multi-level nature of dying began in the early 70s with his interest in near-death experiences. He has few books, 3, and his popular book, Life Afterlife, was a pioneering work in that field. It documents some of the initial research in those areas of non-physical awareness. After the death of his wife, Monroe was motivated to develop a program that helped the dying person understand the transitioning aspect of that experience. He saw death as an important event in a continuum of experience, and it did not signify an ending, but could be used as a tool for great personal learning and growth. In our present-day society, we have lost the awareness of death as being part of an ongoing process, an idea very much part of ancient cultures. We now treat it as a final outcome. In developing the Going Home program, Monroe collaborated with 2 other people, both well known in their respective field. Dr. Elizabeth Kubler-Ross, she's familiar to most people as the one who made it acceptable to talk about death and dying. Through her psychiatric work, she identified the emotional stages of a person in coming term with a terminal diagnosis. Dr. Charles Tart was the other person involved in the development of this program. A noted psychologist and researcher, he has extensive knowledge about state of non-ordinary consciousness. These 3 people designed the Going Home program to help ease the fear of death and dying. The program is a way of helping dying person to move through what might have been a time of fearfulness and confusion, and to adopt an attitude that encourages growth and great self-awareness during this important step of their life's journey. The person then may develop a knowingness that they are more than their physical body and that they will survive the experience of death. On your third chart that you are seeing on your screen right now, these are maybe the benefits that then one can receive from the going program. It can help the one dying to become more comfortable with the entire process towards death, enabling them to perceive it from a much more positive and self-empowering perspective. So you can see a few of them quickly. Provide a method to help ease the fear of death. Releases the one dying from fear of the physical death by the direct experience that they are more than their physical body. Allows them to let go of negative emotion, guilt, and obligation that are no longer constructive. Help the dying person recognize and remember some of the events that happened subsequent to this physical life experience. Provides the one dying the ability to exercise calmly and rationally the option to depart physical existence when they so choose. Give the support group an understanding of the process the dying person is going through, helping to reduce their stress level. Also provide the support group with tools for dealing with their own unique needs before and after the event of death. It can show them they are truly more than their physical body. On chart 4, you can see the recordings that we are using often in palliative care. Those recordings were developed by the Monroe Institute. They can be utilized in combination with each other or individually as the need arises. They are classified into 3 groups with regard to their function. Meta-music is music without words. It can be played as background music or listened to under headphones. It is used primarily to establish a balanced brainwave pattern and general sense of well-being. Meta-music is a really good start for people who never used any sound waves or meditation, and it can also be used at the beginning or really at the end when it's not a time anymore to listen any words, but to really feel supported, to truly feel supported by the sound. And it reduces the fear and at the same time open the person to what's coming. Human Plus Tape addresses a particular need or issue of the patient and provide them with verbal tools to use when necessary, independent of the tape. There is lots of them, but often we have used the one to help to breathe, and it works really, really well. And people also want to, as soon as they listen it once, they want to listen more. We have one for pain control that we should call more to regulate the pain and how we react to the pain. And then we have the mind food category, contains two types of tape, the verbal and the non-verbal. Verbal tapes recordings are similar to a guided visualization, meditation. Then that contain Hemi-Sync sound in the background. Non-verbal recording consists of Hemi-Sync sound with music, with sound pattern, but that reminds people of the guided visualization. And of course, as you see on your the chart on your screen, so there is on top the Going On program. There's the entire series that facilitate an awareness and acceptance of the dying process in order to lessen fear surrounding death. That is the specific program. The Going On program is currently being used a little bit all over the world. We have been offering the program in Riverview Palliative Care Hospital for a few years in Manitoba. And of course, in Manitoba, we are also using it in one-to-one for people who want to die from home or who are not fully ready for palliative care yet. It has given us a lot of insight about where it fits most effectively in a person dying process and who is the most likely to be receptive to it. When someone is admitted to palliative care, they are usually in the last stage of their illness. Most of them are not very receptive to the idea, and it's why we are, in this case, using more meta music than fully guided meditation, guided visualization. We found that they should have exposure of this opportunity full program of visualization a lot before their last few weeks. But a lot of people want to focus on healing instead of embracing their journey. So we are here to really help people and family to embrace the journey. It seems that age is an important factor too, as older people have more trouble to maybe use headphones. But with time, we will find that more and more people are open to use all those tools, because more and more are used with our new technology, with our phones, with apps, and people are starting to be more open. Sadly, we have lots of younger people who arrive at the hospital, and those ones, of course, are more likely to be receptive to the programs. Others do not want to talk about death, no matter how close they are to it. Some are just physically too tired and worn out, having no more curiosity about life. And some family carry too much fear and habits from the past to allow new way of thinking or technology to be able to explore what is happening to them, the one dying, but also them, the one who is going to stay beyond. So we have found that the exposure of the Hemi-Sync music really help all the Human Plus. As Human Plus are tailored more towards healing, they are then more open to talk about death with us and to also agree to explore this different state of consciousness to really understand that they are more than their physical body. There is lots of papers on our website that you can see about some experiences with people who were dying, some who were not fully open to the program, who became open to the program later, and some who were right away open to the program. And so it's really interesting read. So now, in conclusion, we are still learning about the optimum way to present the Going Home program, and I think it's going to be a never-ending process as each generation will be in need of different tool or different way to be presented the program. So now what I often recommend is to learn about death and dying way before we get healed and that it's getting close or that we have really sad diagnosis, and where our brain and our body only want to focus on healing. So we have a program called Explore the Afterlife that help people to discover through the brainwave patterns with Hemi-Sync, to be able to explore like a near-death experience their death before their death. And so your death can be in 40 years from now, and this program will really help you to open yourself more to life, and at the same time will give you all the tool when you have some people around you who are dying. You can then help them. You can help the attitude, the energy, as you have the tool and a better understanding of the step-by-step, emotionally, physically, as it's a really intensive program where you are going to experience a near-death experience. You are going to experience the feeling of death and dying. It's a life-changing program. And of course, when those people, as we have started also, we started this program, Explore the Afterlife, 20 years ago. Some people who later died, their death process was totally different than someone who never experienced this type of program. When you do not have experienced this type of program, you are focused on each little moment, and it's often pain, often fear. But when you approach the program or the end of life with having done this type of program, you already know the tools to use, which tool to use to ease your pain, mental, emotional, or physical. You can go on the website that is written on your screen and have more information, and feel free to always contact us for more information that you would not find in the papers or the website.